Jen Roberts. Thanks for joining me today. Today we're going to be discussing your Medicare meeting. We've made it through week 1 of the patient-driven payment model, so congratulations. And now it's time to refocus our energy and begin to really look at what are Medicare meetings, our triple check meetings, what items are we discussing on a daily basis about our Medicare residents. So let's get started. Your Medicare meeting is typically held on a weekly basis. During this meeting, you should be discussing all of your Med A residents and your managed insurance residents. When we are looking at our managed and our Medicare residents, we want to look at their prior level of function. So prior to them coming to your facility, what was the level of care that they needed? What items were they able to do on their own? That is going to help us establish a baseline. Really looking at that resident prior to the hospitalization and what occurred during the hospitalization is going to help determine how long your resident will have Medicare benefits. When we admit a new patient from the hospital, we really need to be discussing upon admission what their discharge plans are, trying to see if that patient plans on staying in the long-term care community or if they plan to rehab to home is going to impact the care that we're providing based on the resident's goals. So where do they see themselves? Where do they plan on going? When we're discussing with the resident their plan of care and how long they're going to stay in your facility, this is a good time to talk about if home health will be needed, if we're going to have a referral line so that you're able to have that resident call your facility and speak live with the nurse if they have any issues upon their discharge. So during that first week of the Medicare stay or your managed insurance stay, really getting in and setting the care plan with your patient will help drive the discharge process where it needs to go. You need to lead that process and ensuring that we have a plan in place. So during your Medicare meeting, you're going to talk about your residents' prior level of function, their current level of function, and their goals for returning to the community or staying in the long-term care facility. Next, we're going to be discussing what their skilled need is. The Medicare policy still states that we must have a skilled need. If our need is skilled through therapy services, that means we have to have skilled therapy services 5 days a week. If nursing is going to be skilling that resident, then we need 7 days of documentation of the skilled service that we're providing that's over and beyond care that the resident could receive in a home health environment. So in our Medicare meeting, we're going to discuss why the resident is meeting the criteria for eligibility of Medicare Part A. If that happens to be therapy services, which in most cases it is, we need to discuss the therapy plan of care. Where is the patient at in their current journey through the facility? Are they almost back to baseline? Are they at baseline and looking to transition back into the community? We really need to see how they are progressing in therapy and what their goals are. That's going to help drive that discharge process and also ensure that we have the necessary services available to that resident when they discharge to home. Secondly, you want to ensure if there's any barriers to discharge, you're talking about that. The third item we need to discuss during our Medicare meeting is the nursing services. How is that resident doing in their nursing stay? Are we providing IV fluids? Do we have wound treatments? Do we have changes to a pain regimen or medications that we're adjusting daily? And are we reaching out to the physician? We also want to ensure that we are completing our skilled documentation daily. So are we actually doing that? We need to look and ensure that we have the notes so that we're able to provide those notes if we're ever asked to present them as to why the resident was being skilled in your facility. So overall, the Medicare meeting shouldn't change very much in your facility. You want to ensure that you're still covering all of the items that you were previously, reviewing your RUG level, and reviewing the case mix groups as to why you're receiving payment for each area in the patient-driven payment model. And we also want to ensure we don't have any new comorbidities that might prompt us to complete an interim payment assessment. So really discussing that resident holistically to determine what their previous level of function was, what their current level of function is, and what their plan is for return to the community or remaining a patient in your facility. Looking at all of the disease processes that impact that patient and any barriers they might have to discharge. Oftentimes during the Medicare meeting, we'll also talk about how many days the resident is in their stay. So is that resident on day 100? Are they coming close to that day? Really looking at those dates to determine where they are and where they need to be. I hope you found this video very helpful. Make sure and hit that subscribe button and ring that bell so you can receive updates when we release new videos. As always, I hope you have an amazing day, and thanks for learning with Jen.